Atropine sulfate drops are used before eye examinations and to treat certain eye conditions. This medication belongs to a class of drugs known as anticholinergics, and it works by widening the pupil of the eye. It is important to use atropine sulfate drops as prescribed by your doctor. The usual dosage is 1 or 2 drops placed in the affected eyes 1 to 3 times a day. It is best to use the drops at the same time each day. It is important to follow your doctor's instructions carefully for the best results. When using atropine sulfate drops, it's important to wash your hands first to avoid contamination. If you wear contact lenses, remove them before applying the drops and wait at least 15 minutes before putting them back in. To apply the drops, tilt your head back, look upward, and pull down your lower eyelid to create a pouch. Hold the dropper over your eye and place 1 drop into the pouch. Then, look downward and gently close your eyes for 1 to 2 minutes. Apply gentle pressure at the corner of your eye for 2 to 3 minutes to prevent the medication from draining out. If you are using the drops on a regular schedule, it is usually used 2 to 4 times daily. Make sure to replace the dropper cap after each use and do not use the solution if it changes color or contains particles. If you are using other eye medications, wait at least 5 to 10 minutes before applying atropine sulfate drops. It's important to use the drops at the same times each day to get the most benefit and continue using them for the full time prescribed by your doctor. If your condition does not improve or worsens, make sure to inform your doctor. If you experience burning, stinging, redness, or temporary blurred vision in your eye, inform your doctor or pharmacist. Atropine sulfate drops have been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. However, contact your doctor immediately if you experience symptoms such as dizziness, fainting, changes in eye pressure, slow or shallow breathing, mental or mood changes, or a fast or irregular heartbeat. It is rare to have a serious allergic reaction to this product, but seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you notice any other effects not mentioned here, consult your doctor or pharmacist. Before using atropine, make sure to inform your doctor or pharmacist about any allergies you may have. It's also important to let them know about your medical history, especially if you or your family has a history of glaucoma, Down syndrome, brain damage, or spastic paralysis. After applying atropine drops, your vision may become temporarily blurred. It's important to avoid driving, using machinery, or doing any activity that requires clear vision until your vision has returned to normal. Atropine may also make your eyes more sensitive to light, so make sure to protect your eyes in bright light and use dark sunglasses when outdoors. It's important to be cautious when using atropine drops on infants or small children, as they may be more sensitive to the side effects of the medication. Be sure to keep the medication out of their reach and wash your hands after each use. If you are pregnant, it's important to discuss the risks and benefits of using atropine drops with your doctor. Additionally, consult your doctor before using this medication if you are breastfeeding, as it is unknown if the drug passes into breast milk. When using atropine sulfate drops, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. This is why it's essential to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's also crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of atropine sulfate drops. As always, it's best to consult with your healthcare provider for personalized advice on the optimal timing and daily dosage of this medication. If someone accidentally swallows this medicine, it can be dangerous and cause serious symptoms like passing out or difficulty breathing. In case of an overdose, it's important to seek immediate medical help by calling 911 or contacting a poison control center. Symptoms of overdose may include flushed or dry skin, fast or irregular heartbeat, fever, mental or mood changes like hallucinations, and loss of coordination. If you experience any of these symptoms, seek medical help right away. Remember to keep this medication out of reach of children to prevent accidental ingestion. Always follow the dosage instructions provided by your doctor to minimize the risk of overdose. Remember, it is important not to share atropine sulfate drops with others. This medication is prescribed specifically for your condition and should not be used by anyone else. Sharing medications can be dangerous and can lead to harmful effects on the other person. Always keep your medications in a safe place and out of reach of others. If you forget to use atropine sulfate drops on your regular schedule, use it as soon as you remember. However, if it's close to the time for your next dose, then skip the missed dose and continue with your regular dosing schedule. Do not take a double dose to make up for the missed one. When using atropine sulfate drops, it's important to store them according to the instructions on the product package or as advised by your pharmacist. It's crucial to keep all medications out of reach of children and pets. If you are using single-use containers, make sure to discard any unused medication immediately after use. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, be sure to properly discard the product and it is expired or no longer needed. If you're unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.